Hey guys, it's been a while. um, it's been quite a busy past 2 weeks. School has been getting busier with papers. Papers take me so long to write because it's just a reflective paper. I hate reflection papers, but I have to do them. It just takes me a while usually because I'm just procrastinating to get it done. I just don't like spending so much time on it, but whatever. That's just me. I don't really like writing papers anyways, but that's just part of nursing school. I also got sick last weekend, last week, and just been feeling crappy, so I didn't think it would be nice to record a video with my like stuffy red nose and like skin peeling off my nose and sniffling and coughing during the whole video. So I didn't want to do that. And then also I had a couple of dental appointments. And today they had to numb this side of my mouth, my left side, because they had to redo a filling. So if I sound kind of weird, it's probably because this side is numb. And if I make weird facial expressions or start drooling on this side, that's probably why. So today I decided to not postpone writing or recording another nursing video, and it's been long awaited. I've been postponing doing this clinical paperwork video, but I'm going to do it today, so here we go. So clinical paperwork, it's quite a process. There's like many pages to the clinical paperwork, and it usually comes in like packets. So for this, you usually want to be really organized and then make sure you have all the resources and tools and all the data information on your patient. For us, for clinical paperwork, we usually had to do, besides the clinical paperwork packet on our patient, we also had to do like a nursing diagnosis cards for our patient, just because they wanted to know if we knew the pathophysiology that is behind the nursing diagnosis for each of our patients. So for example, here I have a nursing diagnosis week 1 for one of my clinicals in the past couple quarters. You probably can't see this, is probably really bad lighting, but for example, my patient was this week, the first week, had peritonitis and hypertension. So for this, we kind of had to define what the nursing diagnosis was. So for example, define what peritonitis was, and then kind of give an overview of the pathophysiology and the signs and symptoms you would find in this certain disorder or complication, and also collaborative problems. So for example, with peritonitis, you're going to have pain, or there's possibility for infection. You might have a colostomy, nausea, vomiting, hypovolemia, shock, and toxemia. So those are just kind of, that's the basic thing we had to do each time we turn in our paperwork. We had to at least do 2 nursing diagnoses that pertain to our specific patient. And so for this patient, he or she had peritonitis and hypertension. And so the basic thing, I'm not really going to show you the paperwork because it's kind of like paper violation, and this is patient information that I cannot bring out, but I'm just going to tell you like the general just idea that's involved in the clinical paperwork. So the tools you might want to need is you might want to have a black pen, a green inked pen, and a red inked pen and highlighter. I would suggest you get the pen that comes with the 4 different colored inks in one pen, the one that comes green, red, black, and blue, so that you don't have to keep switching pens or lose a pen and then need to find another pen or buy another pen. This one is quite handy because for clinical paperwork, you're going to have usually a maximum for our program. We had 3 days with that patient. We had the preclinical day, which is where we get information. We don't meet with the patient or take care of them yet. We kind of just get the data, baseline data for why they're there, what symptoms they've been having, and how are they doing now. And we usually write that stuff in our clinical paperwork in black ink. And then the next day is our first day with the patient, and we use red ink and then kind of write down any changes or what we saw in our patient. And to kind of, for the second day of care with that patient, we write in green ink. So it's kind of like showing the change of the patient, if they got any better while you were taking care of them, or any dramatic changes. Did they get better? Did they get worse? Just so that you could see as a nursing student, you can see the gradual changes involved with patient care. And so for the preclinical data that you would get is usually you write down like the days of care you're going to be with the patient. You write their code status, when they were admitted, if they're male, female, their age, kind of a brief medical history, why they got admitted, and what are their nursing diagnoses, and kind of write down what you know about the nursing diagnoses. And then you also want to find out their past medical, surgical history, and if they did have any surgical procedures done during their days at the clinic or hospital. You're also going to want to know if they have allergies, because that's a big deal, especially if you're taking care of them. You don't want to be giving them the wrong medication and then they're allergic to that. You're also going to want to know their diet, their activities, what they're able to do, if they're independent, if they can get up on their own, if they need one person assist, and then their vital signs that they have on that day. So you can kind of see if they are hypertensive, they're breathing too fast or too slow, their oxygen saturation, if they have any pain, temperature, if they have any fever, and then you also want to write treatments involved, support services, consultations, and other pertinent information that you need to know for taking care of the patient. And then we kind of have this like preclinical day 1 and day 2, and it's kind of like assessments that you do each day. For preclinical, we're not doing any care for them, so we just kind of fill in whatever they have in their charts or in the computer system. And then day 1, we actually do the full physical head-to-toe assessment, and then we chart in red what we found, and then you can kind of compare what other people found in their assessments. And then day 2, you do it in green, and then you kind of want to highlight whatever is important, and you can see that there's some highlighting involved. And so it covers, for the assessment, covers all different assessments. It covers the cognitive perceptual neuro assessment, pain and comfort, sleep rest, safety, cardiac, peripheral, the IV sites, AV fistulas, gastrointestinal intake output, respiratory, nutrition, mobility, musculoskeletal, skin, and coping, psychosocial, cultural. So it covers literally everything. So you kind of want to know everything related to your patient. So usually by the time you're done with preclinical, you pretty much know all about your patient, since you've been doing all those paperworks, you got their labs, you know their meds, you did that whole, you stayed up all night doing all that information. And what sucks is sometimes you'll have days where you do all that information and then your patient got discharged, or they passed away, so you did all of that for nothing, and then you have to go do another set of paperwork for a different patient and learn about them, and so it gets complicated, but that's just part of nursing school and clinical. So, and then you're also